on the couch with me is Bill. And Bill, you are a psychologist, a psychotherapist by trade, and your writing experience is around academia. Now, we could talk about academic writing, but we've had some wonderful conversations about trauma. And I'm curious if you've actually thought about writing about trauma from a therapist and a patient perspective.
Yes, I have. I mean, one of the things that drove the book I've recently completed was my frustration with a medical model of managing mental health, or probably more importantly, psychological distress. And in the book, I challenge the way psychiatry does its business, and then I give case histories of how, if you understand somebody's trauma, and if you ask the question, what happened, rather than what is wrong with you,
yes,
you actually get to the core of the heart, and to the core of the matter, the heart of the matter, which is overwhelmingly people come into contact with mental health services, not because they've got some mysterious mental illness, but because
something that happened.
Something that happened, exactly right.
And the thing is that sometimes there's no awareness that something that happened to you can have a traumatic impact on your brain and your mental health.
Absolutely. We know that, particularly early on in your lives, if you were to suffer from neglect or what we call acts of commission, where somebody does something very nasty to you, your brain gets wired differently.
It does.
And your brain gets wired for protection, whereas 60% of the population have nice childhoods, their brain gets wired for connection. Now, if your brain is wired for connection, life is easier.
Yes.
But obviously, if your brain is wired for protection, it's wired that way to keep you safe.
It is.
It is.
Our primitive brains are always there to keep us safe, and they revert to a primitive protection mechanism, and I'm sure that people don't realise that that's what happens.
And it's not just the reptilian primitive brain, because that primitive brain is always on the lookout for threat.
It is.
But what is important and what we know is that particularly around the amygdala of the brain, which is actually part of the mammalian brain, we know that if you have a bad childhood, your amygdala gets wired to scan the horizon for threat. Yeah, and it finds it. I mean, it's the red car problem. If somebody says to you, look for red cars, you suddenly realise there's hundreds of them. So, I was going to say a lot. Now, all of my patients, their amygdalas are all on the lookout for threat. And this is particularly...
Stress.
Yeah.
They're in a stress response constantly.
Yeah, well, I'd go a bit further. I think they're in a distress response.
Yes, that's a great description.
But the great problem with trauma is, if you have a nice childhood, you will learn how to manage distress. Your primary caregivers will give you methods
to deal.
Which is talking. So they will talk, they'll connect. However, unfortunately, for all of my clients, they get distressed by their own distress. And they manage that often by using substances, by sex, by shopping, by cutting, by a lot of quick fixes, because they're not the answer. And particularly in dealing with people with alcohol and drug problems, you need to see beyond the substance and see what that substance is actually, what hole that substance is actually.
Because that's not the thing that got them to the point of addiction. There was something else.
Sure. I mean, only 10% of people who drink develop alcohol dependence.
Actually have a defined alcohol dependency, as defined by the psychiatric.
Yeah, well, we won't worry too much about psychiatric diagnosis, which is notoriously unreliable. But look,
it is, isn't it?
Totally. And so the issue here is you always, and the good management of people with alcohol and drug problems, of course they need to get sober or straight, but then you have to do the work which elucidates the trauma. And this is...
And it's hard work, Bill.
Well, it's fascinating work.
Oh, it's fascinating.
As the therapist,
I actually think as being the patient, it's been fascinating for me to learn how my brain, why my brain, but it must be fascinating for you to see the different outcomes of that.
And it is, because what you hear is astounding stories which people have, and you're absolutely right. I think in order to survive as a child, when your life is really at risk or is extremely unpleasant, the only way you can manage on a day-to-day basis is to push it down and suppress everything. Now that's all very well, and you manage by suppression.
You do.
Right? And you try to forget all that, and actually you internalise this into a statement, it's my fault.
Yes.
If only I was better,
Absolutely.
then my parents would love me. The difficulty is that works perfectly well to get you through your childhood. It's a great defence.
Doesn't work in adulthood.
Yeah, well, that is absolutely true, Toni. So the defences we use in childhood then become hurtful and harmful in adulthood. And what happens, and this is a great generalisation, but the wheels of suppression tend to fall off when you're 39 years and 4 days old.
Yes.
It's really interesting that
isn't it?
you can use all this energy
until that point, and then something happens and bang.
And you fall apart. So people talk about having mental breakdowns, which I've always thought is a very strange term. But actually...
We haven't really got something that adequately describes what happens
well,
at that point.
I think what happens, they decompensate. I think because you've had all this suppression. But let me be very clear. The it's my fault hypothesis, which kids use, absolutely saves their lives.
Absolutely.
Because what we discover is that there are always some precocious suicides in children at 8, 9, 10, 11, 12. And what's happened to them is they've suddenly realised that it's not their fault. They are in an impossible position. They are being...
And they're too young, their brains are too immature to deal with that.
Yeah, and they lose the it's my fault thing, and they actually go, no, my parents and my life is appalling, and they kill themselves. So actually, the adopting it's my fault
is a protective.
default is protective. It keeps you going, but unfortunately, you have to in your 30s then switch that around to it's not my fault.
And if it doesn't happen, it will happen in your 40s.
Yeah, it does.
Dr. Bill, what a wonderful conversation. I could keep talking to you for ages, but I've promised everyone that keep them 5 minutes. Thank you so much for your time.
Tony.